All right, folks. We are getting ready for another great time to sit here and learn, move up our health, take it to the next level. Whatever your goals are. Some people's goals are big, some people's goals are smaller. Our hope here is to meet and match you where you are, so that your expectations are just as much with alignment with ours. That it's not about numbers on the scale, but it's more about how you feel and how healthy you want to be. One of my most famous sayings here, or common sayings we have here around the office is, your body doesn't really care about you getting a six-pack. Its goal is to keep you alive for as long as possible. So it's going to do that
before Shopify
at whatever cost that we can get to.
But now you're selling with Shopify. You're easily selling online, in person, and beyond. Discover how millions of entrepreneurs use Shopify to ignite their selling.
So let's hop into it. Guys, I am Dr. Michael Fitch, board-certified family medicine physician, and your coach here when it comes to all things wellness. We are going to spend this next 30 to 45 minutes diving into that topic exactly. So if you haven't heard about us, we are Carolina Life Center. I'm Dr. Michael Fitch, owner and CEO of this company and lead physician. And we are approaching health from the very non-traditional approach of let's not just follow the numbers. Let's actually listen to the patients. And this is a very big concept that hasn't really been around for many people. Many people will say, hey, my doctor tells me that my numbers look great, but I still feel bad. Many times I myself as a physician found myself prescribing medications and telling patients, why don't you go home and try to do a little bit better? So I had to realize one day that if my patients knew how to go home and do life better, they knew how to go home and change their lifestyles to healthier lifestyles, that they probably would have done that before they came and talked to me. So the fact that they are now dealing with high blood pressure, cholesterol, low metabolisms, and thyroid disorders, this is not something that I imagine that people wake up day by day going for the goal of being unhealthy, right? This is something that we really strive to fight against day by day. But a lot of times we don't know what the tools are to give us the best outcomes or give us the best results that we want. You probably heard it all, right? If you drink a lot of water, you'll lose weight. If you skip certain meals, you'll lose weight. If you eat heavy in the morning and late at night and light at nighttime, you'll lose weight. And guys, to be 100% honest with you, there is a little bit of truth to each one of these sayings. The problem is that it's not fully true. And there will be some weight loss that will be seen with any change in lifestyle that one will make. But the problem is that change sustainable? Is that change even being done in a healthy way? And at the same token, will it cause other effects or rebound or start to work against you, even though you're doing everything the same way? So let me just kind of give you an example. How many of us grew up skipping breakfast and we still lost weight? How many of us grew up being able to eat whatever we wanted to eat, as long as it wasn't every day, and we still lost or maintained some level of weight, especially when we were younger, right? So that's probably about 100% of the people who are attending, who are in the meeting here tonight, and probably 100% of the patients who I've talked to over the lifetime of my practice. So patients will tell me, Doc, I've done everything that I know to do, and I still can't get the same. I still can't get any change in my weight or any better results. So what's missing? What's missing is the truth. The truth is that that's not the way that your body functions. Your body functions by one simple premise. You have to have fuel in the tank to run the rest of the operation. It's as simple as that. Is a heart important? Yes, a heart is important. But a heart without any fuel is not important. Is your brain important? Yes, your brain is important. But your brain will do nothing without any fuel. My car outside, when it runs out of gas, it is considered to be dead on the side of the road. When you and I are unable to get energy into our cells, we are essentially dead. I have taken care of thousands upon thousands of patients, and I can tell you with my type 1 diabetics who lack the ability to take sugar into the cells because they cannot produce insulin. If you want to see somebody really struggling in the middle of a crisis, you should go and see a person who is going through what's called DKA from their type 1 diabetes, or who just is having a hypoglycemic event. You will never want to be that type of person at all, right? We all talk about having too high of blood sugar. Is that dangerous? Yes, but it's not nearly as dangerous as having too low of a blood sugar. And so your body is not going to ever physiologically, in a healthy physiological person, your body is never going to allow you to get your blood sugar that low. Instead, your body's going to tell you, go find us some food. Go find a source of fuel or food that we can eat in order to replenish and give ourselves life. So now you have cravings. So now you have the taste to go eat. Now you feel like eating, right? These are emotional concepts, in my opinion. These are not true factual events. An example, I don't feel like doing my taxes this year, but the IRS say there's a requirement and there is consequences to not doing it, where your body says the same thing. There is, you may not feel hungry, but your body still says you either take in sugar or I will make sugar for you. So now we find ourselves up against a problem, because now most of us who have probably tuned in or listening right now are all struggling with some issue with weight. We all feel like we're overweight or not fitting into our clothes in the right way. And it's the summertime, right? Time to get my summer body on. We still have time to lose about 20 pounds before August, when most of your weddings and family reunions and going back to school time period will happen. And everybody is spending this summer either enjoying their summer body or wanting to kind of get into a better shape, maybe before the end of the summer, right? So now, what do we do is that we now spend our time trying desperately to lose weight in the best way that we know how to. So whether that is skipping a meal, whether that is spending 2 hours in the gym, whether that is exercising to exhaustion, or whatever, we may try to do all of these events only to find that they don't work for us. They may help you lose about 5 or 10 pounds, but after that, how many times has that now failed you and the weight comes back? Heck, I even have patients who have had gastric bypass or gastric sleeves and have lost a considerable amount of weight, 200 pounds down to 160. But over the last 6 years, the weight has slowly started to come back up. They went from overeating to not being able to eat anything at all because there's a sleeve holding the stomach so tight that they can't take in but so much food. And they lose weight in a very fast period of time. But usually it's not sustainable. Within 5 to 7 years, many of those patients have regained all the weight, if not more, after having some kind of gastric bypass or gastric sleeve to that extent. Why? Because you cannot not eat any less. You're already barely eating a full meal's worth, and now we're going to try to make you starve even more? No, the body's not happening. Instead, the body's going to start to say, you know what? It's time for me to take over. We'll make the sugar for you. Your sugar levels go through the roof. Here comes the weight coming right back on. You didn't change anything that you did. You didn't eat more. Matter of fact, you're eating less. You're drinking more water. You're exercising more. Where is this weight coming from, and why can I not stop it? It should be a great question that you ask for yourself. Well, your body's not designed in that fashion. And if you are not reading the operator's manual on how to properly work on this piece of machinery, you're not going to get the best results. It's like any other piece of machinery. Can I get it on? Sure. Is it working optimally or properly? No. And that is a difficult conversation for most of us to have, especially when a lot of our beliefs are so deeply rooted in our culture and our tradition and our the conversations we've had with loved ones and those who we have self-identified as being mentors in our life and gurus who don't really properly have the training. You know, who's your biggest guru when it comes to your health and experiencing in this life? Your parents. Your parents typically become either your first or your foundational gurus, but everything else has to filter through. If I were to tell you, eat more often, but your mother told you to skip breakfast, your brain's going to have a conflict. Trust me, I've taken care of enough babies in my life to know that if I tell the mother to not put the rice and cereal in the baby's formula before 12 months, but grandmother says otherwise, that baby's probably going to get cereal. That baby's probably going to get some rice in that formula because grandmother's encouragement or direction usually weighs higher than mine, although my medical knowledge and experience weighs greater than hers. So with that being said, this is a no judgment zone. You tried, you've done all the things that you know how to do, but you still don't have the results that you want. So let's have a conversation. Your body is struggling right now to bring down your insulin levels. Why am I talking about insulin? None of us are diabetic, Dr. Fitch. Well, we all are some level pre-diabetic if we're overweight. When we eat food, all the food that we eat turns into some form of sugar. That sugar has to be stored away or compartmentalized somewhere. That is the job of your insulin, to take that free sugar, which is otherwise damaging and toxic, in an open environment, and to take that sugar and to place it into one or two categories: life or fat storage. So if I go to the gas station today to fill up my gas tank from empty, it's going to take me about $50 to fill up my gas tank. Anything more the gas will start to run over and spill out of my gas tank. I hope that each of you agree to that. If it takes $50 to fill up my gas tank, but I want to pump an extra $20, I have a couple of choices. A, don't do it. B, find another storage tank to store the excessive gas in. Or once I run out of my storage tanks, to let the gas just spray itself onto the concrete, to fully spend all of that $20. And you and I would agree that spewing gas out into the air is not a smart thing to do. But that's what we call diabetes. When you and I eat food, we eat enough food that the body takes that sugar and stores and turns it into life energy. It is bioavailable. It is there to give us life for the next 3 to 5 hours. So I'm just going to say 4 hours on average. If you eat more than your gas tank, your body will take the rest of that sugar, your insulin will take the rest of that sugar and store it away as fat. So if you overeat and you are eating more sugar and more sugar and more sugar, or things that turn into sugar, which is everything, then your body's going to need to make more and more and more insulin in order to store and store and store more fat. The problem with this is it now becomes a self-fulfilling prophecy. High insulin levels will demand high sugar levels in order to maintain that level of insulin. Your insulin has to recalculate and readjust every 3 to 5 days. So if you start eating well and then you have a cheat day on the weekend, guess what happens to that insulin level? It goes right back up. We actually need to have our insulin levels down and low for probably about 2 to 3 weeks before we start to truly appreciate consistent, healthy weight loss. But this is something that usually is too short term for many of us to stay consistent with that type of diet to see those results before the cravings kick in. And the funny thing about those cravings is that most of you think that it's your choice to have them. It is actually so subconscious of a refueling demand that your body says, go eat some food, go have a bowl of cereal, because this is my refueling time period, because you haven't fed us all day. I fall into that category all too often. I wake up in the morning, I go to work, I stay so busy, I forget to eat, I come home, and guess what? Now I'm not busy enough to not be able to listen to my brain when it says we need sugar, we need to refuel, and we need it now. Now, here's the concept. Your body is made out of bones and blood, but most important at our age adults is our muscle mass. Muscle mass demands protein in order to help it to grow. Protein takes an extended period of time to turn into sugar inside of our body, but carbohydrates don't. Carbohydrates turn into sugar within our bloodstream within 5 to 10 or 15 minutes. So you're out of crisis in a very short period of time as by eating some mashed potatoes or sweet potatoes as compared to eating that piece of steak. But the truth of the matter is you will be right back in a crisis so much sooner if you only ate the carbohydrates like that cookie or that snack versus had you eaten the protein, which would have kept you satiated for a lot longer time period. I have so many clients who will come and tell me it's difficult to get myself to stop eating. I find that I have to eat every 2 or 3 hours. I don't understand, why am I never satiated? Why am I never full? And a lot of times when I start to pick apart their diet, guess what their diet has a lot of? Sugar, and it has a low amount of protein. Guys, help yourself out. Give yourself a balance. With each meal, I'm not gonna be this person who's gonna demonize carbohydrates. But what I am going to tell you is you need to have a calculated or proportionate size of carbohydrates along with protein. Think about it like any else in life. You need something right now to kick you off to give you energy now, but then you need something that's going to sustain you over time. Otherwise, you're up and down on a roller coaster. So a piece of fruit along with some chicken breast, a slice of toast in the morning along with a protein shake on the way out the door. Combine them and find how much more satisfying, how much more stable your blood sugars are, and how much they will start to come into effect. But again, remember, the body will kick in those stop gaps in order to fight against it if you do it too fast or if you don't have assistance on board. That's where we come in. We are here providing two amazing products: semaglutide, which is the compound version of Ozempic or Wegovy, and tirzepatide, which is Mounjaro or Zepbound. These are two great weekly injections that people take that, number one, controls their cravings and regulates and controls their background blood sugar, especially for those of you who decide like you like to skip meals. So these medications are very great medications. They're super easy to take. The side effects are not that bad, guys. Don't let a lot of people confuse you and scare you with those side effects. There are some things that we need to talk about. But for the most part, many of these things are so easily controllable and regulated that it's very, very easy nowadays for most people to lose weight in a very well and healthy and controlled fashion. So whether you feel like you need to be on the semaglutide to be able to control some of your portion sizes or your cravings, or you need to be on tirzepatide to help you to control your blood sugar from spiking up because you skip a meal, we are here to fulfill that order for you. Sign up today, schedule a free virtual appointment, especially if you don't live in our region of Roanoke Rapids or Wilson, and we'll be more than happy to hop on the phone with you, schedule an appointment, and the medications will be directly on their way from our compound pharmacy to your house in less than 7 to 10 days. So with that being said, amazing, amazing, amazing opportunity for most people, especially for those of us who are not diabetics. Right now, Ozempic and Mounjaro and Zepbound and Wegovy are only approved for those people who have diabetes or those people who have a proven heart disease, such as congestive heart failure, heart attacks, strokes. There's a couple of others. But with that being said, pre-diabetes and hypertension by itself is not enough of a condition for your insurance company to justify paying for this medication for you. So most people who are not yet ill of diabetes or a heart attack and don't ever want to get to that point are really trying to get on these medications, but are being turned away or having to pay in somewhere of the excess of $1,000 for a 1 month supply. And I have even had some of my patients who have some amazing insurance, state supported insurance, Blue Cross and Blue Shield, whatever you want to call it, right? But they still don't have the diagnosis of diabetes or heart condition. They still have pre-diabetes. And even though their insurance company will approve for them to get on the medications like Wegovy and Zepbound, which are indicated more for obesity, There's still a significant copay. There's still a copay around $400 plus. There's the burden of having to go to the pharmacy to get the medication before or after work. And oftentimes the frustration of getting to the pharmacy only to be told they don't have that medication in stock. There's a back order on it. There's a supply issue with it. And that's simply because these new medications from these big pharmacies are not able to really keep up with the demand. But the compound pharmacies who are getting the semaglutide and the tirzepatide directly they have a great supply, and they're able to keep up with the logistics that we're pushing towards them and get that medication directly right out to you. So with that being said, great idea to go ahead and spend at least $79 on yourself a week in order for you to start to see some of the weight loss results that I know you and I are looking for even before this summer is over with. Again, take advantage of our summer special, $79 a week for the first 4 weeks to get started on semaglutide or tirzepatide. And then after that, the price does go back up to around $89 to $99 a week, depending on which medication that you're on and the strength of the medication. But we're here to make this affordable for everybody. So even at our higher level medications, they're still on average are about $100 a week. That's not a bad price, right? In my mind, I'm trying to do min math. $100 a week is me going to McDonald's 6 times out of the month. 6 times out of the week. You cannot go to McDonald's and spend less than $15 if you're a foodie like I am, right? You're going to get at least one meal, right? A sandwich, fries, drink. You're going to spend $15. And you're going to get a lot of calories and sugar, which are all going to turn right back into fat. So not only are you now poor because you're giving McDonald's your money, you now are even more unhealthy because the food that you did spend this on during the time when you were hungry was not in your best benefit and healthy for you. So invest in yourself, put that $90 aside for you to help you to lose that weight and get in shape, reduce your risk of heart disease, reduce your risk of diabetes. Did you know that having diabetes is almost a 50-50 shot towards having a heart attack or dementia as an older person with uncontrolled diabetes? Crazy correlation. But you know what? I would do it every day. I would do it any day to reduce my risk factors because I've seen diabetes and heart disease, and I don't want any part of it. If you're interested in getting it, let us know. Look us up on the web, our website, carolinalifecenter.com. Schedule your virtual appointment, and let's get you going. Now, let's talk about hot topics. So today is June the 16th, 2024. Oprah Winfrey, who was the Weight Watchers spokesman for many years, who herself has struggled with weight back and forth and has tried diet plans and things of that nature, recently exposed that she herself was on the GLP medications, semaglutide or tirzepatide. We're not really quite sure which one, but she does admit to being on the GLP medications. And according to her, she says that she's on Ozempic, right? And I think a lot of people probably take that as a good option because what does it do? It keeps the stomach tight. It helps you to control your portion sizes and turn away those cravings that you would have at other times by taking away some of that food noise. But just in case you can't hear that food noise and you decide to overeat, guess what? It's going to make you feel a little bit nauseated. It might even make you sick. So this is immediate great biofeedback when a person looks at their plate and says, I can't eat all that. I know I'm going to get sick if I eat that entire plate. So they start cutting the plate in half, taking it down to better portion sizes that are much more manageable for them. and for their stomach, and for their blood sugar, and for their weight loss. So with that being said, semaglutide is a great medication. Now, in the GLP family, let me say a couple things. You got 3 effects. Effect number 1, there's going to be tightening of the stomach by the GLP medications. This is the opposite of what insulin does, because insulin wants you to eat more. So it's going to help your stomach to open up and expand. Option number 2, it's going to help slow down your digestion. Insulin's going to do the opposite. It's actually going to speed up your digestion because it wants to get that food out the way so that it can get the next supply of food in. So here you're going to have food that's in the way, giving you the sensation of feeling fuller longer. Option number 3, the next time that you so decide to skip a meal, your body has to relegate itself to making its own internal sugar. Again, this is a piece of machinery that at all times requires fuel. I have 2 options. I either A, eat the fuel, or B, I make the fuel internally. My car, this inanimate object outside, only has one option to stay alive. Fuel has to be put into it from the outside world. It requires external motivation in order for it to stay alive. Once that gas is gone, it has no other option except to turn off and die. You and I can't do that. If you decide to skip a meal, I can't have you just dying on me. And your body's not going to do that anyway, because again, its main job is to keep you alive as long as possible. So what is it going to do? It's going to help you to break down muscle mass, not fat, muscle mass, in order to turn that into sugar in order for you to stay alive. And your blood sugar will go through the roof, way higher than had you just had a regular meal. So this is why the celebrities, this is why your aunt, this is why your friends, your husband, your best friend, this is why all these people are on this medication, because it is giving them the feedback that you ate too much. It's keeping them fuller longer so they don't find themselves snacking in between, and it's keeping their blood sugars and insulin levels down so the cravings are so much less. Now, I'll tell you, in my opinion, Ozempic does an amazing job with the first 2, and tirzepatide does an amazing job with the second 2 options. So depending on whether you're an overeater or an undereater would really depend on which one of these 2 medications will work the best for you initially and long term. Now, our friend Oprah Winfrey says that, she's been struggling with weight all her life, and she decided to go with the semaglutide or the Ozempic product because I'm imagining Oprah says she needs the feedback of overeating. I can only imagine the burden of being financially free and being able to buy and purchase whatever you want in whatever quantity that you want. Many of my patients, even in my early years, told me that one of the main reasons that they were alcoholics was because they could afford alcohol. Before they had good jobs, they couldn't afford alcohol. So even though they had a good taste for it, they did not drink in excess because they didn't have the money to drink in excess. One of the best things that we do is we don't have the money or the time to just eat and eat and eat, right? You're at work, you're managing other bills. Many of us have to determine, do I cook out? Do I go and get fast food, or do I plan my meals and cook at home in order to stay on a better budget? But the rest of us tend to do the opposite, right? We skip meals. But in Oprah Winfrey's case, she says that her main concept was that she needed the Ozempic or the Wegovy to control her diet and her cravings. Recently, we see that Oprah Winfrey was just hospitalized for having some kind of gastric or stomach concern, which has brought up so many flags of, I wonder, did the Ozempic or the Wegovy cause this? Because we know that the semaglutide products will cause some stomach upset. And a lot of people all have the same question about gastroparesis. Is this going to slow down my stomach to the point where my stomach now becomes paralyzed? Guys, that is very rare. In my opinion, we need to kind of continue to look into Oprah Winfrey's case, because obviously, you know, we're getting the information that they are reporting to us. And I have to kind of read in between the lines as a physician. And what we realize is from the studies that we're hearing is that, number one, Oprah Winfrey says that she went in after having several days of not being able to keep down fluids. So this sounds like she was nauseated consistently, not just per meal. That, in my opinion, sounds like more of a acute, chronic, viral or illness that's kind of going on, versus the side effects or symptoms of semaglutide for the majority of patients. Number two, gastroparesis. Gastroparesis is oftentimes another form of nerve damage or neuropathy, where the nerves in our body are just not operating like quite how they should. And so here in the stomach, the nerve pattern would tell the stomach to move food through the wave of our intestines. So again, semaglutide or the GLP family kind of slows down some of that impulsivity of that nerve signaling to the intestines, right? So the wave is a little slower. That allows more time for nutrients to be pulled out and more time for water to be pulled out. And yes, this can lead to constipation, but generally not full gastric paresis. Full gastric paresis is usually an indication of severe, prolonged nerve damage. And we oftentimes see this most commonly in our diabetics. Our uncontrolled diabetics who the blood sugar levels have been high for so long, they've come back and they've damaged the nerves. And now we put those patients on Ozempic or things of that nature, and now that pushes them over the edge. Also, when medications like this come out, they have to report every symptom that the trial patients had while being on this medication, whether it truly was caused by that medication or just was associated at the same time. You can be in a trial of Tylenol, and in the midst of the trial of Tylenol, have a heart attack, and they will have to report that Tylenol causes heart attacks. Is that true? Probably more studies and research needs to be made, but I would tell you it's not common. And because that's not reproducible, we have to imagine that it is the extreme patient, the outlying patient, that we need to really do a better job of pre-screening before putting them on a medication like this. Now, the big question that I ask my patients when I put them on semaglutide or tirzepatide is, do you have a prior or entering condition of having constipation? And guys, I will get a variety of answers. No, I don't have issues with constipation. Yes, I do have issues with constipation. Sometimes I have constipation, sometimes I have just the opposite. And I will tell you that each person's understanding of their bowel movement pattern is different for each person. The one person would go to the bathroom every day. Now, physiologically, again, this is not emotionally, this is not emotional. This is textbook Dr. Michael Fitch's understanding of physiology based on what I was taught in medical school. What I was taught in medical school is that when the pipe here opens up to take in food, the pipe on the other end should open up to let food out. So how often should we be having poop per day? You should really be trying to have a poop after each meal that you have. But most people would settle for having one bowel movement a day. If you think about a child, especially think about a baby who is probably something like a baby who's breastfed tends to have a good amount of wet urine diapers a day and a good amount of stool or dirty diapers a day, as compared to the child that's even on formula. The child that's even on formula, their bowel movements will slow down to only being once a day. And we recognize that some foods, breast milk, vegetables, fibers, different things of that nature, tend to help the motility to speed up to stay regulated. So again, what's normal for me may not be normal for you. Me saying that I need to go to the bathroom once a day, and then you telling me that you all your life have always gone to the restroom every 3 days, I would define that as constipation. You may say in the interview time period, I don't have problems with constipation because this is the norm for you. The norm of going every other day, the norm of going once a week. So that's not constipation for you. So we generally define constipation from an emotional standpoint of a change from my baseline. But the baseline really should be set not just by you, but by what is physiologically normal for most people. That's going to the bathroom once a day. So now I got a person who only goes to the bathroom 2 or 3 times a week, more like 2. That's most of my patients are patients who only go to the bathroom about 2 times a week. It blows my mind that the same people who struggle with weight tend to also struggle with consistent bowel patterns. They all are also the same patients who tend to suffer from low functioning thyroids. So all of those things together, and now I also overstress the body by not giving it all the nutrients, can really put together a really, really poor cocktail. So now with that being said, here's Oprah Winfrey now signing into the hospital because she says that she's severely dehydrated. She didn't complain about stomach pain, but her comment was she was unable to really keep a lot of fluid down. So she decided to go and get some IV fluid directly from the emergency room. Do I believe this? I don't really know. I mean, I would imagine that Oprah Winfrey, who only needs some IV fluid, probably could call any concierge doctor, home delivery doctor to come to her house and give her some IV fluid. But I also know that any good concierge medicine doctor who had a patient who said, I'm having extreme severe abdominal pain, would probably tell them to go to the hospital or emergency room first to have that ruled out before just getting IV fluid. So we don't quite know where Oprah Winfrey is. Could she be having significant severe side effects to the semaglutide? You know, she's been on it for an extreme and a long period of time. Oprah Winfrey and all of these celebrities were taking Ozempic for, I would say, probably going on about 7, 8 years. Like if you go back, you start looking at those pictures of Oprah and Kelly Clarkson. I think Al Sharpton. I want to say other people. You know, they've been slowly making these changes in front of us over the years but within the last 5 years, it really sped up. So could it be a combination of how long should I really be on Ozempic? How long should I really be on these medications? How high of a dose should I really go on with these medications? See, these are great protocols and these are great things that we should really talk about. But, many people, especially people who have the money, can afford to buy higher and higher dosages of medication. That's why it doesn't become a factor for them. If 2 milligrams was good, and now I'm having resistance against 2 milligrams, maybe I should just go up to 4. Maybe I should go up to 5. No, maybe you should start changing some of the things in your lifestyle, right? Maybe we should start watching our macros. How much protein a day? How much carbohydrates a day? How much exercise a day? What else should we put into this goulash of health that we have left off? I would tell you that changing your diet, especially when your weight is very far away from your ideal weight, will make drastic changes. But when it comes to losing weight and getting in shape and getting healthy, there are always 3 things that you need to consider. First of all, your diet. If you want to win or lose this battle of weight, the battle of the bulge, that battle is won and lost at the dinner table, at whatever you're putting in your mouth or not putting in your mouth. Regulate and control your blood sugars throughout the entire course of the day and throughout the entire course of the week in order to have a consistent weight loss. Versus many of us who roller coaster all day long because of either the food choices that we're making, high sugar, or because we're not feeding and our bodies are going into these mini crises every 2 to 3 hours, doubling our blood sugar, trying to get us away from this danger of starvation. So that's number 2. Number 1, control your diet. Number 2, cardiovascular. Increase your metabolism is important throughout life, but even more importantly, after the age of 40, after childbirth, or after what we call menopause or menopause. In this time period, age and the age of my thyroid and metabolism is no longer enough to keep my weight under control. When you were 12, yeah, that was enough. Have a peanut butter and jelly sandwich, have 2 slices of pizza, just be 12 and you'll lose some of the weight. But now I'm 49, now 63. My metabolism has slowly calmed down about every 5 years. But I can jumpstart my metabolism for a few hours each day. Number 1, how do I do that, Dr. Fitch? I'm going to explain it to you. Number 1, make sure that you're giving your body all of the nutrients that it needs. All of the nutrients that it needs. Welcome to the United States of America, where the majority of our foods are undernourished in micronutrients. So A, make sure you're taking a daily multivitamin. 2, limit the crisis. Crisis being physical crisis being emotional crisis, or chemical crisis. So try to eat consistently throughout the course of the day so that you're not putting yourself into the crisis of making your own blood sugar. And then go exercise a little bit. If you exercise, a good number show that 15 to 30 minutes of exercise is really all that you need to, number 1, not overdo it, but number 2, to enhance and spark your metabolism for the next 2 to 3 hours of the day. Over exercising does the opposite. It actually can turn your metabolism down and off for the next 2 to 3 hours of the day. So find the sweet spot. Don't over exercise. Don't over stress the body. Number 1. Number 2, diet. So number 1, diet. Number 2, exercise, increasing that metabolism. But number 3, weightlifting. The only thing that is designed to eat away at muscle directly is muscle mass. The only thing to eat away at fat, the only thing to eat away at fat directly is muscle mass. However, whenever you and I skip a meal, we get that source of fuel back from our muscles, not from our fat. When you skip a meal, you do not want to break down an important organ such as your brain just to give you some more energy. You would rather rob that energy source from the muscles in your legs or your arms to get out of that danger zone. So now here I am going from 200 pounds to 140 pounds, but are you 140 pounds of muscle or are you 140 pounds of fat? That is a big question. Many people will go, especially those who are on an extreme starvation diet, will go and they'll get down to 140, but their body is not in the same dynamics as it was even before they started. There's not as much muscle mass there. And as soon as they start to re-eat or refuel, all of that energy that they overeat goes towards fat, and there's nothing to oppose the fat. You've already turned down the metabolism because you've undereaten, you've affected your thyroid, and now there's no muscle mass there to regulate the fat. Do you now understand why when you come off these crash diets, why it's so easy for that weight to come right back on? If you don't, just put your hands up, raise a question. I'll try to re-explain it in a different way, or let's talk, schedule an appointment or schedule a consultation so we can talk about this later. But guys, these are the most important things. So is Oprah Winfrey having side effects from Ozempic or Wegovy or semaglutide? The jury's out. But I can tell you that number one, with having a healthy protocol, a protocol that doesn't get to be too excessive, right? We go up to probably our highest dose, and I'll be straight honest with you. Our highest dose, our maintenance dose, is usually about 1.5 milligrams. We find that anything higher than 1.5 milligrams, 2, 3, 4, usually has more side effects that are going to cause that are going to increase our risk. Right? And if you're getting to the point of needing 2 milligrams of semaglutide to regulate your diet and control your weight loss, you're probably not on the right medication. Or there's a better combination of medications that we may need to put in together so that we can keep both of those medications low, because when we have medications at low maintenance levels, we generally don't have those side effects. I give you a prime example for something that is right in your household right now. I guarantee that in most of you guys' households, there is either a bottle of Tylenol or ibuprofen. Now, how much Tylenol can I take a day? You can take 2 extra strength Tylenols about 3 or 4 times a day before causing any harm to your liver. You can do about 600 milligrams of ibuprofen 3 times a day before causing and harming your kidneys. But doc, I'm in chronic pain. I broke my back. I have fibromyalgia. I have so many chronic pain syndrome issues, and that amount of Tylenol and that amount of ibuprofen is not enough. Is it okay for me to take more than what you just recommended? Sure. No, sorry. Will I have better control of pain if I take more of that medication that you just recommended? Yes, you will have better control of your pain if you take 6,000 to 7,000 milligrams of Tylenol a day. Is it healthy? Will it cause damage in the long run? Yes. Yes. I mean, there are even patients who have had issues with their stomach that I will tell them directly, I want you to take ibuprofen for the next 2 days. And they'll tell me, I had gastric bypass, I had ulcers, my doctors told me to never take ibuprofen. That is very, very true. But this is only for the next 2 days. I'm probably not going to cause any major side effects or damage with you taking this medication for 2 days as compared to 2 years, right? So again, our goal is to help you with achieving your weight loss as soon as possible so we can get off the medication as soon as possible. A good option for weight loss or a good goal for weight loss is about 2 pounds per week. That's our goal. Will there be some people who lose weight faster than 2 pounds per week? Yes. Are there patients who are going to lose weight, who are going to lose less than 2 pounds per week? I sure hope not. And if you are, we got you on the wrong medication, or are we going to need some more additional coaching because we've missed something. So with that being said, when you got those patients who are very encouraged to lose so much weight and they're willing to do such a high dose of medication, then we really have to worry about what's going to happen next. So I have a lot of patients who say, hey, doc, I got 100 pounds to lose. How long is that going to take? Well, maybe about 50 weeks. That's about a year, right? Is that too long of a time period? Not at all. Not at all. It's not too long of a time period, but now we really need to be monitoring for any complications that may be developing, especially malnutrition. Dr. Fitch, how much medication do I need to be on? Well, we have a protocol, like I explained to you beforehand, where we ramp everybody up to what we consider to be our maintenance dose. But then there are some patients that may need to go higher than that. But our goal is hopefully not to go, but so high. So again, when we have patients who are either on this medication for an extreme period of time or on super excessive doses of that medication, then this is really where we need to really kind of have more of a conversation side by side and talk this through so that we make sure that we are not going to cause any of these unwanted side effects, right? So right now, I don't know of any side effects to semaglutide and tirzepatide. I really, truly don't. I know unwanted effects. There are some unwanted effects, such as I'm nauseous and I'm sick to my stomach, so I don't feel like eating. There's unwanted effects of I don't eat on a regular basis, and since I started taking this medication, now I get sleepy if I don't eat. Well, that's great. Go eat. Control instead of letting your body make all that blood sugar in the background, you control how much blood sugar your body gets by eating. But what I do sometimes see indirectly is because A, you're under eating because you're so nauseated, or B, you are not eating enough to meet the demands of the current burden of your life. Then I have seen some people now go into what I would call a vitamin deficient state. So people may find that, their taste buds change, or they're more tired. There's a little bit more fatigue. There's a little bit of some thyroid concern, maybe even some hair loss. This is not a side effect of the Ozempic or the tirzepatide, the semaglutide or the tirzepatide or Ozempic or Mounjaro. This is generally a secondary side effect that the person was not keeping up with the nutrients needed for their body to continue to operate. And now the protection gaps in the background have also been hindered. So this is really a function of reprogram yourself, eat healthy to stay healthy. Don't only rely on the medication. So with that being said, guys, we're going to continue to follow Oprah. We're going to pray for her. We really hope that she has the best and fastest recovery. We really, truly hope that we get some truth and honest answers for what has happened to her, especially since Oprah is such a big proponent for the GLP-1 family medications. And we know that she's been on these medications for an extreme period of time, or I wouldn't say extreme, but we know she's been on it for a prolonged period of time. So we're going to hopefully continue to monitor this. But for any of you guys who are already on the medications, if you're noticing a change in your bowel movements, if you're noticing a lack of the ability to just get in the basic calories and the basic macros, the proteins and the carbs for the day, contact us. We really need to have that conversation. We really need to make sure that you're keeping this tempo at the most optimal level as possible. Just last week, we had one of our patients who came in and said, Doc, not only have I been constipated, now this patient was one of those patients who normally only has a bowel movement about twice a week, but at this point had not really gone to the bathroom in about 2 weeks. Had gone from being twice a week to not having a bowel movement in 2 weeks. So now this person was extremely constipated. They were starting to have a little bit of that abdominal pain and pressure. But here was the biggest thing that really kind of alarmed me and really had me a little bit worried. The person said, I'm even having difficulty passing gas. We really know that the poop is really bulky and is really in the way from being able to be expelled. Super easy answer, a super easy solution to that, guys. We started the patient on our bowel protocol, our constipation prep protocol, and within 24 to 48 hours, the patient was calling us checking in with our nurse, because we obviously do our due diligence and making sure that we're providing you guys a great follow-up, and says, I can't believe it. Tell Dr. Fitch thank you. After 24, 48 hours of being on his protocol, I'm now having bowel movements. I'm passing gas. The pressure in my stomach is gone, and now I feel like eating again, right? Because when their stomach was so full, the whole desire to eat was not there, which would only cause more problems towards losing weight, especially affecting the thyroid, right? So with that being said, guys, don't be out there by yourself trying to lose this weight. A lot of the ways that we gain weight, guys, are based on programming that occurred to us even before we were consciously aware of it. What do I mean by that? What 3-year-old has not heard these famous words? What 3-year-old or 4-year-old or 5-year-old has not heard these famous words? You better sit down and finish the rest of the food on your plate before you can go play, right? We have all programmed from a very early age our children to do what? Not listen to their brain when it says, hey, you're full enough to go play, right? Instead, we want them to sit and have a good meal so they can go play and not come back and forth every hour or two saying, Daddy or Mommy, I'm hungry again, right? It becomes more of a convenience for you to have them to eat all their plate at one time, even though their body is saying, hey, I'm already full. Number two, a lot of this programming was made even before we ourselves had the ability to screen it. So number one, it was programmed into us before we realized we were being programmed. And number two, it was coming to us from people who we in our brains identified as being smarter than us, but not necessarily checking their credentials. My mother told me, my daddy told me, my grandmother told me, my best friend told me. And we make medical decisions based on that. And we allow that information to get through the barriers or the filters in our brain because of the resource that it came from. I think your mother, I think your grandparents, I think your father, I think your friends are wonderful people. But if they don't truly have a degree in medicine, make sure that you review it with somebody else. And This is not unheard of. Don't get upset with me if I said something that was a little triggering for you, right? If I had an issue with my car, right? If I had a concern with my car, would I be better off taking it to my grandmother who has never dealt with the car other than to drive it, or would I be better off taking it to a mechanic? Well, you know what you would do. Most of us would probably take it to the mechanic. And there are some of us who would rely on what grandmother said, and hopefully grandmother would tell you to also take it to a mechanic. But that's not always the case. Guys, we are here to help you to be the healthiest that you can be. We have our top options, our top 4 options here at Carolina Life Center. Number 1, if you live within our service region, right now, our first office is in Roanoke Rapids. We're looking to expand to bring our second office a little further south around the Smithfield, Wilson County region, that Johnson County, Wilson County region. Will keep you updated to that, so that if you are in our service regions, you can definitely get more of our services. But if right now you are not close to our service region, then we are here to help you with your weight loss journey with a virtual appointment. In that virtual appointment, we can start on our weight loss medications, which we have a variety of different options, and have that medication delivered directly to your home. Step 2 that we also offer is an evaluation of your thyroid health. We can have you have a set of labs done right in your region, and we can start to medicate any dysfunctional thyroid that people have. Realize that thyroid dysfunction is not always acquired with age. Some thyroid dysfunction is inherited at birth, right? Number 2, if you are in our service region, then you may also want to come in for one of our IVs. During the summer is a great time to tank up on hydration. Between what your body expels, between how much you sweat, even right now as I'm talking, I'm losing water vapor. So if I don't hydrate, I'm going to have a dehydrated crisis state, which is just going to put me right back into the same feeling that we talked about earlier, along with weight gain. Come in and see us right here at Carolina Life Center. We can get you hooked up on an IV. Usually takes about 30 to 45 minutes to get 100% of our vitamins and hydration into your bloodstream. Most of our patients are already telling us how great they feel halfway through their first bag. Most people get about 1 bag every 2 weeks to every 1 month, just to keep themselves at maintenance. Third of all, this is a new season for all of us. And so if you're trying to prevent wrinkles, if you're trying to rebuild the facial structure, you want some lip enhancements, things of that nature. If you're in our service region, make an appointment. Come on in for a Botox session, a filler session. Let's see if we can not only make you feel great, but also take away some of those defects that are holding back the way that you may feel like you may look great. Okay, and I say feel because that's everybody's opinion. And then last of all, but not least, non-surgical joint repair. Arthritis is real, especially for those of us who are overweight. We put more burden down on our feet, our ankles, our knees, our hips than the majority of the common patients or people in society outside of the military and outside of athletes. So putting an extra 100 pounds on top of my knees will speed up the rate of arthritis. Also, our lower back. So why does my body not heal itself properly? And simple said, there's trauma, but there's delayed healing. The healing in our body takes place by a chemical called a stem cell. And most of our stem cells are very active when we are first conceived and born, but as we age, those stem cells start to slow down. Don't believe me? Cut yourself or fall down and break a bone. A child will heal their skin or their bone within a short period of time as compared to a 60 or 70-year-old adult. I would prefer to break a bone at 12 years of age than to break a bone at 72 years of age. Not just because, I can remember the pain, but because it's probably not going to heal as good because I don't have the same amount of stem cells. Well, we are able to harvest stem cells from you, from your body, or from an outside source and give you a dose of stem cells in whichever joint affects you. Right now, many of our most common places, our most popular places to treat are knees, hips, back, and shoulders. We also treat some of the trigger fingers, especially a lot of people who have the pain in their thumbs as well. So schedule an appointment, give us a call. Let's see if we can help make you feel a little bit better. And so with a lot of our patients, let me just kind of say this, one shot is giving a lot of patients pain relief for up to 3 to 5 years. I'm not trying to say that this is a magical treatment, but it does an amazing job of reducing inflammation, helping to regrow tissue, far superior to what pain medication and steroid shots will do. Does it compete against surgery? Not necessarily. Surgery will always clean up everything, but there will be pain and recovery time from even the surgery that stem cells can also help out with. So with that being said, guys, Dr. Michael Fitch here at Carolina Life Center, right here in Roanoke Rapids, North Carolina. Come check us out and stay tuned. Follow us on Facebook, TikTok, Instagram. Be aware if you are in any of our service regions, stop in, just come by, say hello, make a free consultation to see if you're a right client to continue to work along with us for our coaching. And again, as we start to open up our locations in the Wilson or Johnson County, right now we got 2 locations that we're really looking, we're really doing our due diligence on seeing which one of those is going to be the best for our fit. We will keep you updated and hopefully be a lot closer to you. So again, thank you so much for attending. We're right here every Sunday night at 7:30 and Tuesday night for our exercise weight loss class. So until next week, take care.